Hello, good day, everyone. So today's topic is mycobacteria. Okay, so mycobacteria is an infectious agent, the causative agent of tuberculosis, which is still endemic here in the Philippines. So every year, around 10 million people fall ill with tuberculosis or TB, which is the common infection caused by Mycobacterium, specifically Mycobacterium tuberculosis. Okay, so despite being a preventable and curable infection, there would still be around 1.5 million people who would die of TB every year. Okay, so that would make it the world's top infectious killer. Okay, TB is, of course, a leading cause of death in people with HIV. It's also a major contributor to antimicrobial resistance. Most of the people who fall ill with TB live in the low and middle income countries like the Philippines. Okay? But TB is present all over the world. So about half of all people with TB can be found in countries like Bangladesh, China, India, Indonesia, Nigeria, Pakistan, South Africa, and of course, the Philippines. Okay? So about a quarter of the world's population is estimated to be infected with the TB bacteria. However, only about 5 to 15% of these people will actually acquire active TB infection. The rest will have TB infection but are not ill and will not be able to transmit the disease. Okay? They'd be able to uh, get over the infection because their immune systems are capable. Okay, so both TB infection and tuberculosis, no, are curable using antibiotics. So learning outcomes for this topic is that at the end of the discussion, you are expected to be able to identify the different Mycobacterium species, their characteristics and properties, the virulence factors that they have, as well as the type of diseases they're able to cause. Okay. Secondly, you're expected to be able to explain the pathogenesis of the disease caused by Mycobacterium species, and lastly, to be able to differentiate the tests used to identify Mycobacterium species with emphasis on principles and the results that would come, no, after performing the tests. So learning outcome. So general characteristics of the organisms are that the cell wall has extremely high lipid content. Okay, they resist decolorization with acid alcohol. That's why they're called acid fast. Okay, so basically, they are aerobic organisms. They are technically non-spore forming, with the exception of Mycobacterium marinum, which upon extreme stress, they're able to produce a spore-like structure. Okay, they're non-motile. Uh, Primary infection would usually show thin, no, or slightly curved or straight rods. But those that are already drug resistant appear to be really um, broad or wide, okay? Chubby, okay, ang ating drug resistant bacilli.
Okay, so colonies of our Mycobacterium are cauliflower-like, no, warty. Okay, so they usually grow really slowly. No, they would need around 2 weeks the least and 6 weeks the most. Okay, so medyo slow grower talaga itong ating Mycobacteria. Okay, so among the species, no, of Mycobacterium, Fortuitum and Chelone can grow, no, as early as 3 days. Okay, pero that would require a modification in McConkey. okay, to allow them to grow really well. Okay. Mycobacterium leprae, on the other hand, will require living cells in order for them to grow. Okay. So we can use living cells, or you can use the agarose medium. No? Slightly different from those artificial medium that we use in the laboratory. Okay, so Mycobacterium tuberculosis is the one of the two clinically significant species of Mycobacterium. Okay, so the other is Mycobacterium leprae. So this particular organism is known as Cox bacillus, or the tubercle bacilli, which was identified by Robert Koch during 1882. Okay, so this is known to be the agent of tuberculosis, or previously they call it consumption, because the person infected would appear as if he or she was consumed from inside. Okay? So payat na payat, di ba? They look so thin and fragile. So it's because of the effects of the virulence factors of Mycobacterium tuberculosis. Okay? So it's a chronic infection. People, no, that may be infected may carry them. No? Some may carry them for life. Okay? So in the 20th century, this believed to be the second leading cause of death. Okay? So not everybody who will be host to the tubercle bacilli will actually have the active infection. Okay? Some will just have the latent TB infection. Okay? So that's about 95%. Only very small percentage of people who were able to inhale or were exposed to the bacilli will actually develop full-blown infection. Okay? So our Mycobacterium tuberculosis are infectious primarily because of very powerful virulence factors, okay? Aside from the mycolic acid that they have. No? But most of its virulence factors are actually based on mycolic acid, like mycoside. So mycoside is a basic virulence factor. It's a mycolic acid that's bound to carbohydrate. Okay? Cord factor is a type of mycoside that is formed by the combination of two mycolic acid with a disaccharide, usually a trihalose. Okay, so again, the base virulence factors is mycoside, and then they would have several modifications to produce different types of virulence factors. No? So we have the cord factor, which has two mycosides, or mycolic acid rather, and then attached to a disaccharide. This virulence factor is actually really powerful. It allows the organism to inhibit neutrophil migration. So white blood cells will not be able to rescue your infected cells because they're not allowed to migrate towards the infected site. Secondly, the cord factor is also responsible for the release of tumor necrosis factor, which is responsible for the cachectic look of people with TB. No, they have cachexia. Okay, they look like skin and bones. Okay, so there's rapid weight loss. Okay, so that's because of the cord factor. Other virulence factors include another mycoside, no, which would be similar to cord factor. It's just that this one is attached to a a sulfide. No, the disaccharides are bound to sulfates. Okay, so that's your sulfatides. Okay? So sulfatides are responsible for allowing your TB bacilli to survive inside macrophages or phagocytes. Why? This is because your sulfatides will inhibit the fusion of lysosome bags with the phagosome bags that would contain the TB bacilli. Okay? So there will be no digestion of infectious agent, primarily because the lysozymes will not be able to come in contact with the phagosome bags. Okay. Then we have the WAX-D. The WAX-D is an unusual virulence factor. This one is actually a virulence factor that is helpful to us. Okay? Why? Because this virulence factor is actually antigenic. Okay? It enhances antibody formation to an antigen. No? So they call it adjuvant. Okay? So WOX-D is an adjuvant property, which would mean it's antigenic. It's able to trigger antibody formation. Okay? So those are the virulence factors of Mycobacterium tuberculosis, among the many other virulence factors. It's common to most organisms. Okay? Now, Mycobacterium tuberculosis is again the agent of the infection tuberculosis, which is usually a respiratory tract infection. So, ang pinaka-common na form is the pulmonary TB. Okay? So, this can be acquired by people who are exposed to those who are positive for the bacilli. Okay? So, either by talking or sneezing, so inhalation of airborne droplets, there. So, that's the usual mode of transmission. Okay. So very typical of people with TB is the presence of uh, densities, densities around the apical region of the lungs here, sa taas. Okay. So quite common. Okay, so how do our Mycobacterium tuberculosis able to cause primary TB? Okay, so as the susceptible host, acquires the infectious agent by talking to somebody who's infected, the pathogen will enter the respiratory tract, and then it will go down towards the alveolar area of the lungs, where the infectious particle or infectious droplet will be met by our alveolar macrophages. Okay? However, remember, your TB bacilli has sulfatides, which allows them to survive inside your alveolar macrophages. And so they grow inside those alveolar macrophages. But of course, the presence of the antigen inside our host cells will trigger the release of cytokines, and information will be spread out that there's an infectious agent somewhere near the lung area. So hosts immune cells will gather around the infected alveolar uh, macrophages and produce this so-called granuloma. Okay, so this is quite visible in X-rays. No? So the infected cell is found in the center. It will be surrounded by your immune cells. Okay. Eventually, the alveolar macrophages will run out of oxygen, and so it will die, and it will undergo several stages of necrosis. No? So it will undergo caseous necrosis first. Okay? There would be cheese-like materials, and then later on it will undergo liquefaction necrosis. Okay? And then it will create a scar, which will be visible for a very long time. So tubercle, the tubercle is formed. Sometimes, sorry. Sometimes the tubercle may burst, okay? And it may lead to another type of tuberculosis called the miliary tuberculosis, where there are small groups, small granuloma growing all over the lungs, because the bursting of the tubercle will allow spread of the infectious agents in the other areas or regions of the lungs, compared to when the granuloma is intact. So the spread of infection is controlled, because of the presence of the layers and layers of immune cells. Okay, so again, if the granuloma bursts, it would increase the probability of spreading the infection. Hence, we have the miliary tuberculosis. So other forms of TB would include the Pott's disease or tuberculosis spondylitis, which is the TB of the spine. Okay, so the infectious material invaded the spinal vertebrae. Okay, so again, the miliary tuberculosis, it's extrapulmonary TB brought about by bursting of the granuloma. So there are several mini groups, no, mini tubercles found in different organs. Okay. Now, this infection is again treatable. No, we have a wide range of antimicrobial drugs that can be used to treat tuberculosis. So we have the first line of TB drugs, which would have the mnemonics RIPES, no? So rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. Now, apart from that, we have second line agents, which would include ethionamide, capreomycin, ciprofloxacin, cycloserine, rifabutin, ofloxacin, and even kanamycin. Okay, so in cases where people are reacting to the first line TB drugs, they can always opt to use the second line agents. But remember, they're not as strong as the first line of first line of antimicrobial drugs. So usually the treatment is 6 months, with 4 different antibiotics first. And then when required, an additional 2 months is usually allotted for extended treatment. Pero this would only include a pair, of antimicrobial agents or a new set of antimicrobial agents, not necessarily the first 4. No? So this organism is actually prone to resistance, no, acquiring resistance. Okay? So a large number of Mycobacterium, or a large number of strains of Mycobacterium tuberculosis have proven to have acquired resistance. No? So we have the multi-drug resistant TB bacilli. They're usually resistant to rifampicin and isoniazid. So if we're not really dedicated to making use of the set treatment regimen, no? Pataka lang tag-inom. Okay? So that would result to resistance to the drugs. Okay? And then we have the extensively drug-resistant TB bacilli. So these are multi-drug resistant TB bacilli, plus they are resistant to your second line of TB drugs and also fluoroquinolone. Okay? So, unsa na lang itambal? Okay? So you have to be really careful, no, when making use of antimicrobials. Okay? So for prevention, so wala pa, no? For preventive measures, we have the Bacillus of Calmette and Guerin. So the patient is not yet infected. Usually, this vaccine is given during the first few hours of birth. Okay? So Bacillus of Calmette and Guerin. So sa mga babies ito. Okay? Vaccine for babies. Okay? So this includes strain of the attenuated live bovine tuberculosis bacillus called the Mycobacterium bovis. So this one is so closely related to your Mycobacterium tuberculosis. Okay? And we also have tuberculin skin tests. Okay, so skin tests which would identify, no, the TB infection. You may make use of this, no, tuberculin test. It would make use of purified protein derivatives of the organism. Okay? You can also do TB blood tests, of course, no? Skin tests and TB blood tests. So a positive TB skin test or a positive blood test only tells that or informs us that the person is infected. Okay, so it will not tell whether the person has latent type of TB infection or the active type of TB infection. Okay. So aside from the skin test, you can also make use of chest X-ray. Of course, the sputum test. No, you can also perform that. Okay. What else? The skin test example. The most common example of the skin test is the Mantoux tuberculin skin test. Okay, so this is performed by injecting a small amount of tuberculin. Okay, so that's the uh, antigenic material, no, that we insert into the intradermal area of the patient. Okay. So after 48 to 72 hours, we watch for the production of an area of induration. Yeah, no? So the MAN2, that's the most common method of skin tests, no, for TB. Okay, so this is intracutaneous injection of about 0.1 ml of purified protein derivatives. Okay, or 5 tuberculin units. Again, area of induration, so redness, swelling beyond the original swollen area. Okay. So apart from MAN2, you can also use the von Perke, the Volmer's patch, Moro percutaneous, and the tuberculin time test. Ayan. So laboratory diagnosis, what are we supposed to do when we are able to collect samples from the patients? Okay. So we have to make sure that the sample is correct. Okay. The best sample would be purulent or mucoidal. Sometimes if the samples may be blood stained, but again, it has to be purulent or mucoidal. If the sample is more on saliva, you'll have to ask the patient to submit, no, resubmit samples. Okay. So 2 samples, early morning sample specimen are collected 1 hour apart, no, for at least 3 consecutive days. Before, it was only supposed to be 1 sample for 3 consecutive days. Okay. So now 2 samples, 1 hour apart, okay, for 3 consecutive days. Yan. So, if for example, your test comes up negative for acid fast, you'll have to think that probably mucus, proteinaceous materials may have covered the organism or blocked the organism, so you can't view them under the microscope for acid fast staining. So it would be best to try and decontaminate as well as digest the samples. Okay, so the most common decontamination and digestive chemical that we use for sputum is sodium hydroxide, 2 to 4%. Okay, so it's a mucolytic agent. Or you can use the N-acetyl L-cysteine or the diosretol. So this would also include the use of 4% sodium hydroxide. So you'll have to add, no, sodium hydroxide to uh, NaLC or dithiotretol. Okay. Zephyran, which is composed of benzalkonium chloride, can work with trisodium phosphate. Okay, so we call that ZTSP. Okay. So benzalkonium chloride will shorten exposure time. Okay. TSP, on the other hand, would liquefy, no, samples that are it would rapidly liquefy samples rather. Okay. Pero kailangan daw ng mahabang exposure. Otherwise, you'll not be able to release the organisms from fibers or other proteinaceous materials. Yeah. So with your samples, if they pass, no, the grading system for sputum samples, so you can perform the staining method. So either Ziehl-Nielsen or the hot method or the Kenyan stain or the cold method. Okay na okay lang. Okay? So both Ziehl-Nielsen and Kenyan have carbylfuchsin as primary stain, has acid alcohol as the colorizer, and methylene blue as counter stain. Okay, so the only difference is that Ziehl-Nielsen applies heat or steaming, while Kenyan applies or includes, turgidol. We don't heat in Kenyan. Rather, we make sure that we added a wetting agent to allow the walls of the mycobacterium to soften and allow absorption of the chemical or the stain. Okay. Now, of course, in the laboratory, before you are able to check, whether or not the samples do contain the organisms, the first thing to do, of course, is to prepare your smears. And there's a special way to prepare your smear, okay, for direct microscopy, okay, direct sputum smear. So you'll need a template that would measure around 2 by 3 centimeters, okay? And you are required to read at least 300 fields. So 2 lines or 2 rows at 150 each, no? And you can read that under oil immersion when you read your slides, your acid fast slides. Okay. So gram stain qualifies if the organism is acceptable for the Bartlett's criteria. Okay, remember yung Bartlett's criteria? Dapat there should only be less than 10 epithelial cells and greater than 25 polymorphonuclear cells. Okay, so here added in the screen are the reporting, for our microorganism, when we need to quantitate them. Okay. So 0, no acid fast seen in 30 fields. Positive N, okay, plus N, if you're only able to read less than 10 acid fast in 100 fields. So you can use N, plus N, and then your answer. Okay. Your counted organism. Okay, your plus N, plus, and then your counted organism. Okay, so less than 10, that's plus N. So you can write plus 5, plus 9, if you're only able to read those or see those. Okay. Now, 1 plus, 2 plus, 3 plus would refer to the following. So 1 plus, if you're able to read about 10 to 99 acid fast, okay, per 100 fields. 2 plus, if you were able to read 1 to 10 acid fast bacilli in at least 50 fields. And 3 plus, if there were more than 10 acid fast in at least 20 fields. Okay, so that's how you're supposed to read your direct sputum smear. Ayan. So, culture media. Okay. So, the culture media for our microorganisms include agar-based medium. Okay. And then egg-based medium would be the other. The agar-based types of culture media, would contain serum and albumin, such as your Middlebrook 7H11. Okay, so it would contain 1%, 0.1% casein hydrolysate. Okay, so this is really good for improving the recovery of your isoniazid-resistant Mycobacterium tuberculosis. So perfect for growing your drug-resistant strains of Mycobacterium. Okay, and then this Mitchison's selective 7H11, this would also contain inorganic salts to allow successful growth of or isolation of your Mycobacterium tuberculosis. Okay. Then we have liquid media. Okay, so this is actually really good for cultivation, yung liquid media. Okay, so they would grow more rapidly in liquid media compared to plated media. Okay, so we have the Bactec 12B medium. So this is included in the Bactec machine. Okay, so it's really quite efficient in isolating your TB bacillus. Okay, and then we have the Middlebrook 7H9 broth for aseptically collecting from aseptically collected samples. So like your CSF, for example, right? Synovial fluids and pleural fluid. Okay, so they can be used. Your Middlebrook 7H9 broth may be used for those, not for sputum. Okay. Middlebrook 7H13 may be used for larger volumes of blood samples. Okay. And then we have the egg-based. Okay, so The other type or the other group of Mycobacterium media are the egg-based media. So this comes with egg yolk, they serve as a lipid source, and malachite green, which is the inhibitory agent. Okay, so we have Petragnani, Lowenstein-Jensen. This one is the most commonly used. And then we have the ATS, or the American Thoracic Society. However, Petragnani here contains twice the concentration of malachite than Lowenstein-Jensen. Okay, so recovery of your organism from heavily infected or heavily contaminated samples is best inoculated on your Petragnani. Okay. And so this is how they would look like, no? So your TB bacilli would look like warty cauliflower-like colonies, no? So they're quite, they would look like breadcrumbs actually, no? On your Lowenstein-Jensen media. Okay, they're non-pigmented, just a little off-white or light yellow, very pale yellow. Okay. Yeah, no? Breadcrumb appearance on your Lowenstein-Jensen. Whereas the MAC or the Mycobacterium avium complex, they appear like condoms, no? They look like condom colonies here. Yeah. Okay, so the T. bacilli that will look like breadcrumbs, and your condom colonies for your MAC, no? Or avium complex. Okay. Now, biochemical tests that you can perform for your tuberculosis are niacin. Okay, so most most mycobacteria possess the enzyme that would convert your free niacin to niacin ribonucleotide. Okay, so once your uh, organisms has been categorized into uh, preliminary subgroup based on its growth characteristics, it would be best to determine, no, if they are able to accumulate niacin. Okay, so niacin is actually nicotinic acid. No, it plays a very important role in the oxidation reduction reactions that would occur during metabolism of these organisms. So actually, all species would produce nicotinic acid. Okay? They would produce nicotinic acid. However, Mycobacterium tuberculosis accumulates the largest amount of nicotinic acid. Okay? Hmm. So 95% of our TB isolates, okay, they produce nicotinic acid or free niacin because they do not have the enzyme that would convert niacin, into niacin ribonucleotide. So magtapok ra iyahang nicotinic acid kasi wala siyang enzyme pang breakdown nun. Okay, so niacin plus the reagent, okay, plus an amine that would be present in the media would create yellow pigmented compound. No? Kaya pag nag-yellow, positive yan for niacin accumulation. So Mycobacterium tuberculosis is positive for niacin accumulation. And then of course, nitrate reduction. Okay? Mycobacterium tuberculosis, Kansasi, Schulgai, fortuitum are positive for nitroreductase. No? Therefore, okay, they are able to reduce nitrate to nitrite. However, the rest of the species are actually negative. And then we have the catalase test, but this one is unlike the catalase test that we perform for differentiation of staph and strep, no? So this one would allow the demonstration of the heat stable type of catalase. Okay? So mycobacteria are catalase positive. Okay? So, however, not all strains produce a positive reaction. Okay? After the culture is heated. So you'll need heating for this. Sabi ko nga kanina, it's unlike the one that we use to differentiate your staph and strep. So here, you'll need to heat your culture at 68 degrees Celsius for at least 20 minutes. Okay? So again, most Mycobacterium tuberculosis do not produce complex organisms. So you can differentiate, your TB, bacilli, okay, because they don't produce heat-stable catalase. Okay? So positive lang siya for your, tawag nito, for your routine catalase test. Pero those that will produce, the bubble tower like this, okay, hindi niya kaya. Okay. So twin 80, what we usually use here is twin 80 plus 30% H2O2, what we use for your catalase test, the routine catalase test is just 3%. Okay? So twin 80 plus 30% H2O2 plus 2 weeks old culture. Okay? So you can observe the reaction after 5 minutes. So if the column size is greater than 45, no? So that's usually positive. If it's less than 45 pero meron, you can repeat the procedure for that. Okay? So at least, okay, 45 mm, no? More greater than 45 mm. And then of course, twin 80 hydrolysis, no? So twin 80, okay, some mycobacterium possess a lipase that can split the detergent twin 80. Now, remember your twin 80 is able to reduce surface tension because it's a type of detergent. Okay? So the lipase that some mycobacteria may possess will break it down into oleic acid and polyoxyethylated sorbitol. Okay, so the pH indicator here is methyl red. So it's usually bound to twin 80 and they both have an amber color. So if twin 80 is hydrolyzed, neutral red can no longer bind with it. Therefore, it will produce a dark pink color. Okay. So the commonly non-pathogenic slow-growing scotochromogens and non-photochromogens, okay? They produce lipase that can hydrolyze twin 80. Okay. So twin 80 hydrolysis is quite useful for differentiating species of photochromogens, non-chromogens, and scotochromogens. And then aryl sulfatase. No? The enzyme aryl sulfatase is present in most mycobacteria. Now, test conditions can be changed, no? They may be varied to distinguish the different forms of the enzyme. Okay? So the rate at which the enzyme breaks down phenolphthalein disulfate into phenolphthalein. Phenolphthalein usually forms a red color in the presence of sodium bicarbonate. Okay? So the rate at which the enzyme breaks down phenolphthalein disulfate into phenolphthalein and other salts help to differentiate certain strains of mycobacteria. Okay, so this is actually a 3-day test. Okay, so it's particularly useful for identifying the potentially pathogenic rapid growers like fortuitum and chelone, as well as the slow-growing marinum and schulgai. Okay, so your slow-growing marinum and schulgai are actually positive. They would be positive in the 14-day test, whereas your uh fortuitum and chelone, since they're rapid growers, they would be positive for the 3-day test. And so this again summarizes the biochemical tests, no, for identification of mycobacteria. You have niacin accumulation, Positive C. tuberculosis because it does not have the enzyme to break down niacin, therefore it would accumulate. Bovis is negative. For nitrate reduction, positive, no, C. Mycobacterium, Kansasi, Schulga, and Fortuitum. And then for catalase test, most mycobacteria are able to produce a height, no, or a tower of bubbles greater than 45 millimeter in height, except for Mycobacterium tuberculosis, no bubbles. Okay? So less than 45 lang, sometimes less than 45 ang height of bubbles. Okay? And then we have twin AT hydrolysis. This would differentiate your non-photochromogens and scotochromogens from Mycobacterium tuberculosis. Okay? Aryl sulfatase test, positive C for Twitum keloni, negative naman si tuberculosis and your avium complex. Okay. Bovis, no? Another species is Mycobacterium bovis. So this is it can also cause TB, no, in people. Okay? It's mostly found in cattle and some animals such as bison or deer. Okay. So in people, Mycobacterium tuberculosis cause TB that can affect the lungs, the lymph nodes, other parts of the body. However, as with Mycobacterium tuberculosis, not everyone infected with bovis becomes really sick. Okay, so people are most commonly infected with bovis by eating or drinking contaminated or unpasteurized dairy products. Okay, so that's why we need dairy products to undergo pasteurization because it will kill disease-causing organisms in milk na nanggaling sa cow. Okay? So infection can also occur from direct contact with wounds, no? Such as those that may occur during slaughtering or hunting, okay? Or inhaling bacteria in air that was exhaled by animals infected with bovis. Okay? So direct transmission from animals to humans through air is thought to be rare, but for M. bovis, it can spread directly from person to person when people with the disease in their lungs cough or sneeze. Okay? And of course, we have Mycobacterium leprae. Okay? So, the causative agent of Hansen's disease or leprosy. Yeah? So, leprosy is an infection of the skin, mucous membrane, and peripheral nerves. Okay? So, the non-tuberculous type of Mycobacterium, no, M. leprae, is a close relative of Mycobacterium tuberculosis. Okay? So leprosy is a chronic disease of the skin, yeah, no? So it will also affect our nerve tissues. Okay? So leprosy actually remains a worldwide public health concern as a result of development of drug-resistant isolates. So Hansen's disease is not really considered highly contagious, no? So unless you come in contact with people who are positive, no, yung lesion nila, nahawakan mo, okay, tapos may lesion ka rin or may sugat ka din, ayan. So you allowed entry of the organism. Okay, so there are two forms of Hansen's disease. We have the tuberculoid and the lepromatous. Okay, tuberculoid leprosy has a restricted pathogenic growth. Okay, so hindi siya ganun kabilis spread out. However, it's characterized with skin lesions and nerve involvement. There's the typical loss of sensation in a patch of skin. Okay. It has a relatively high cell-mediated immunity. No? It's a lesser severe case of leprosy, and it does not involve a higher amount of bacterial load. Okay, so patients eventually exhibit an effective self-mediated immune response. Lepromatous type, on the other hand, is extensively spread all over the body. No, has a very poor cell-mediated immunity. Okay, and it's the most severe form of leprosy. No? It involves a relatively higher bacterial load. Okay? So characterized by skin lesions, progressive lesions, no? Symmetric nerve damage, and they don't usually produce a really effective cell-mediated immune response. Okay. So, the skin tests that we use to identify Mycobacterium leprae is called lepromin test. Okay. So this uses heat-killed suspension of your Mycobacterium leprae. Okay. This also lacks specificity. Okay. There are two types of reaction. You have the early or the Fernandez and the late or the Mitsuda reaction. So if the induration appears 24 to 48 hours, that's Fernandez or early. Now, if it would occur after weeks, okay, then that's the late or the Mitsuda reaction. And so remember, your Mycobacterium leprae is difficult to cultivate in an artificial media. Kailangan niya ng living cells for growth. Okay, so it can be grown on footpaths of mice or armadillos, relatively because they're far from the main body and they're cooler in that area. That's why dun sila, no, tumutubo. Okay? Then we have the other species of Mycobacterium, yung hindi masyado clinically significant. Okay? So those that are not tuberculous, no? So Mycobacterium other than tuberculosis or MOTT ang tawag dito sa kanila, or non-tuberculous Mycobacterium or NTM. Okay? So we have 4 groups under the Runyon's classification. First group is photochromogens. These are organisms that can produce pigmented colonies when they're exposed to light. Okay, so this would include your Kansasi, no? The yellow bacillus, or the Mycobacterium marinum, which would mean of the sea. No? This is the causative agent of swimming pool granuloma. And then we have the second group, which are the scotochromogens. This group can produce pigment both in light and in dark. Okay? But they're slow growers. Yun din naman si group 1, slow growers din. Okay? So, this includes Mycobacterium sinopi. Sinopi is isolated in hot water tubings, no, in the hospital. Okay? So, they produce branching colonies with aerial hyphae. No? Their colonies are described as bird's nest colonies. Gaya niyan. Okay? And then, of course, we have Mycobacterium gordoni or the tap water bacillus. The reason why we don't use tap water when doing acid-fast staining kay basig makontaminate sa inyuhang Mycobacterium gordoni. At sasabihin yung may TB ang pasyente. Okay? Then we have the third group, the non-photochromogenic. So this group will not produce pigment either in light or in dark. Okay? So again, to recap, group 1 produces colored pigment in light. Group 2, no, scotochromogens, they produce pigments in both light and in dark. Si non-photochromogens naman, they do not produce pigment kahit na may light or dark. Okay, so this includes the Bati bacillus, which is also known as the M. avium intercellulare, or the or the avium complex. Okay, very common in people with HIV. And then we have M. terrae, or the radish bacillus. Kasi the first isolates of terrae were taken from radish washings. Okay, so doon nakita. And then we have rapid growers. Okay, so rapid growers, group 4, they can produce visible growth within less than 7 days. Gaya ni Fortuitum and Chelone complex. Okay, so they can grow in McConkey without crystal violet. That's the modification for McConkey to allow Fortuitum Chelone to grow. Okay, so that would end our discussion on Mycobacterium. I hope you were able to review, no, what you have learned previously in the last semester. Okay, so basa-basa, read your books, your references, okay, para we will be able to successfully pass our assessment on this topic. Bye, guys.